try to push away the imposter syndrome. It's something that we all go through, especially coming from different countries. But once you get here, and especially if you get into a good residency program, you're going to have a lot of support. You're going to make good friends. You're going to feel at home eventually. So that imposter syndrome haunting you initially will go away.
Welcome, everyone. My name is Dr. Moss from Life as a Patient Doctor. I am very excited to interview Dr. Anton Lima, who's a third-year psychiatry resident and about to be a child and adolescent fellow at the University of Miami. He's dedicated a good amount of his time to educating others on social media and on a variety of mental health topics. Thank you so much for joining me, Anton.
Thank you so much. I've been following your work on social media for a while now. It's a joy to be invited to be part of your podcast. Thank you again.
Of course. I'm so glad to have you. Tell me a little bit about yourself and your journey into medicine.
Sure. So I was raised by a family of doctors. My parents are doctors. Back home in Brazil, I'm Brazilian. So I grew up in that environment. They would come home after work and sometimes talk about cases they had at work. None of them are in psychiatry though, but I grew up in this family of physicians. So I was drawn to the medical field because of my parents' influence. It was a natural path for me. So I started medical school. I was not really excited with anything I was studying in medical school until I came across psychiatry in my elective and during my clinical rotations. As a last year medical student, I actually started thinking of my current specialty my last year of medical school. So yeah, psychiatry, my field of interest. Family was a little bit resistant initially because, hey, this is something new. No one in the family is doing psychiatry. Are you sure this is what you want? They were not being judgmental. It's just something that is completely different from what the family was doing back home. But yeah, it was what I like, and I definitely don't have any regrets. And here I am.
How cool, coming all the way from Brazil and then a whole family of doctors. So I'm guessing you're an IMG, is that correct? Tell
Yeah.
me about that journey, because I know that is an additional challenge of overcoming.
That was a big challenge. So I'm very attached to my family. Moving to a different country by myself. I'm not married. I don't have any kids. So I did the whole transition by myself. It was definitely a challenge. What changed my mind into coming to the United States was the fact that sometimes I was a little bit frustrated back home in Brazil because I wanted to provide the best care to my patients, but sometimes we don't have a lot of resources in Brazil, especially because my medical school was dealing with the public health system in Brazil. We didn't have access to the gold standard treatments and medications for my patients. I was a little bit frustrated during medical school because of that. So I thought, let me try to do something different in my career and get a better training. Maybe in the future, I'll be able to provide the best care to my patients with more resources and access to different technologies, medications, and procedures. So this is what made me decide to come here to the United States and continue my career here. No regrets. Sometimes we miss home, we miss family, but it's good. The good thing about living in Florida and in Miami is that the weather is pretty much the same. It's a tropical state, at least South Florida is a tropical part of the country that reminds me a lot of my roots, and it's closer from home as well. So I have easy access and easy flights to go back home quite often. I'm always going back home every 3 months. They're always flying to Miami to visit me. The transition was not too bad because of that.
I'm so glad because, yeah, I can only imagine, especially talking about different language, different culture, different medical system. Tell me about any other challenges or accomplishments that you've had throughout your journey.
Yeah, I would say challenging was studying for the step exams by myself, right? Because here in the United States, medical school, what you learn in medical school, they tailor that to the exams. They give you some education on how the exams are going to be. They prepare you for the questions. In Brazil, I didn't have any education for that. My lectures on medical school were completely different and they were focusing on our residency exams back home in Brazil. So I had to do the whole thing by myself and study how tough the step exams can be. So I had to do everything by myself. I didn't have any friends in medical school who were interested in joining me. So I did everything by myself. So that was definitely challenging, but it was also a triumph to be able to say, hey, I did it. I made some good friends along the way. They're friends till this day. Definitely an accomplishment. Yes.
No, I completely agree with you. It is an accomplishment, and because there is so much more requirements as I've started to help other medical students and graduates, not just from the United States, but IMG, so many additional requirements and things that we just are lucky as medical students going through the US medical system don't have to worry about. If there are other individuals that are applying as IMGs, what would you tell them for advice?
Well, that try to push away the imposter syndrome. It's something that we all go through, especially coming from different countries. But once you get here, and especially if you get into a good residency program, you're gonna have a lot of support. You're gonna make good friends. You're gonna feel at home eventually. So that imposter syndrome haunting you initially will go away. I have some friends that were really anxious and nervous about starting residency here in the United States, but like a few months in, they were able to adapt well and they were feeling much more comfortable. So try to push that imposter syndrome away and everything will fall into place with time. That would be one of my advices. I would also tell them that it is really important to make connections if you're coming from a different country because a lot of these process is about your network and your connections here. So try to make friends along the way, show interest in this process and in your specific specialty as well, because people can really help you. If you do everything by yourself, it might be a little bit harder. So try to make good connections. I think that's really important as well.
I love that. Those are two great examples and suggestions. And it's something that I think a lot of individuals can relate to, especially individuals who have some marginalized identity, whatever that is a language barrier, racial, disability. It's so important to try to move away from that imposter syndrome. And I'm still trying to figure out how to get out of it because it is so hard, especially when other individuals don't have similar experiences to you.
Yeah, it's just like you said, sometimes even if you do your medical training in the United States, you still feel this way. Imagine if you come from a different country, a different culture. That can be really tough, and with a lot of us.
What steps did you do to try to work through that imposter syndrome and feel more connected and feel like you belong?
One of the things I did initially when I was joining my program was I try to be part of every happy hour, every residency meeting. I really try to get connected to my co-residents and other people in my program. Even some of the attendings that I have in my program go out with us. We have a few drinks, we gather for happy hours. So I really try to join the community and I really try to be part of this community here because we have a big residency program for psychiatry. We have 14 residents per class. So eventually you're going to find a group of people that you like. You might not be close friends with everyone, but you're going to find a group of people in your program that you're going to be connected with. So try to be part of all the gatherings, all the happy hours initially, and eventually you're going to feel more connected. You're going to be feeling part of that family, that community. I think this will help you a lot.
That's so true. And I think it's important when you're trying to find a residency program to find individuals you can connect with because you're going to
Yeah.
spend a lot of time with them, whether you want to or not.
And you can have a sense of how the residents get along with each other because you have the virtual happy hours, usually the night before the official interviews. So you're going to see how they're going to interact with each other, their level of satisfaction. So you can have a sense of how your life is going to be at that specific program based on how the other residents they're behaving, let's put it this way. So
I think we skipped over specifically psychiatry. You said it was towards the end of your career. So, what made you differentiate psychiatry versus the other specialties?
yeah, that's a great question. So basically, I was not interested in anything else. Nothing was getting my attention and enthusiasm. And when I came across psychiatry, I said, hey, this is something different and disconnected from what we see in general medicine or internal medicine. This is really specific, but at the same time, it's really interesting. I was seeing patients in different specialties taking psychotropic medications, and one of their complaints was related to mental health issues. So I was seeing that psychiatry was everywhere. I had a bunch of patients that I was seeing in this OBGYN appointment. She was telling me that she was struggling with depression. She was struggling with anxiety or fear of giving birth to her baby. You're recognizing the mental health issues, even in different specialties with patients that were not there for mental health purposes. Mental health is everywhere. I think it's just calling me. I think our patient population in psychiatry is increasing day by day with kids, with people getting older as well, people living longer. So we are having a lot of geriatric patients. The future of mental health is going to be really exciting.
Oh, yes. I think that is one of the reasons that everyone wants to go into psychiatry nowadays. It's everywhere. Is everyone, I say everyone who's human is gonna have mental health. They have a mind, so they're gonna have some sort of health challenge or just life in general. I'm interested, you chose child and adolescence. What made you go that path?
Yeah. So I adore working with kids. And when I did my child psychiatry rotation as a second year, right? Because as a PGY2, you go through the specific areas of psychiatry. So when I did my child psychiatry rotation, I loved it. We have great attendings in my program who are child and adolescent psychiatrists. They're great, like references and examples that I want to follow. So that rotation was really mind blowing for me. I really enjoyed it. I also think that most of the psychiatric conditions and diagnoses, they start in childhood. I'm not talking about like the neurocognitive disorders or nothing like that, but a lot of the psychiatric conditions, they start in childhood. Many of the psychiatric diagnoses we have, they're neuromental in nature. So if you're able to intervene and recognize those conditions early in life, I think you're gonna have a better prognosis for your patients. You're gonna be able to provide better care. It's I really considered when I decided to choose my specific area of psychiatry. Also, the fact that if you're a general psychiatrist, you usually don't see kids. Doing the fellowship in child psychiatry allows you to see kids with more confidence and without like liability fears or nothing like that. It was something that convinced me to do my fellowship in child psychiatry.
That is so true. I'm also interested in child and adolescent, but then I'm struggling because I'm like, but I like elderly, seeing it in older adults too. Going back to why psychiatry, seeing it in OB-GYN population. So it's hard to pick.
I feel like next year, once you go through your second year rotations in specific areas, you're gonna have a better feeling of what you want to do.
That's good to hear. I'm glad that it's like medical school. You don't have to know right away, even though there's definitely that imposter syndrome and fear that you have to know.
Sure.
There's time. I'm interested, is there a certain, like you said, the child and adolescent, a lot of things do show up. Is there a specific diagnosis that you're interested or passionate about, or certain types of populations?
Yeah, I like to work with mood disorders. I like work with anxiety disorders. What I think it's really fascinating as well about child psychiatry is how childhood traumas can shape your entire personality and be a triggering cause of multiple psychiatric conditions throughout your life. Childhood trauma is a big thing and something that really gets my attention and interests. I really like working with mood disorders and anxiety. Of course, there's a lot of autism spectrum disorder. There's a lot of ADHD in kids. I also enjoy working with this patient population, but I feel like my preference is to work with mood disorders, anxiety, maybe some prodromal symptoms of psychotic disorders, which I think is really interesting in kids and adolescents. So I think this is my area of interest.
That's awesome. And I'm so glad you said childhood traumas because that is my passion. Traumas in general, because they do show up throughout the lifetime. Looking back now that you've spent 3 years in psychiatry, is there anything that you would tell me as a first year psychiatry resident that I should look forward to or make sure I do?
Yeah, that's a good question. And I think one of the main things is go through your residency open-minded and exploring everything. It seems that you already have these in mind, right? You're going to your second year and still don't know what you want to do, even though you have that interest in child psychiatry, but you also like different patient populations. So try to go through residency open-minded, embrace every opportunity. Keep in mind that if you're not doing child psychiatry, you're only going to have probably 2 or 3 months in residency to work with kids and try to make the best out of it. Same for the other specialties. Maybe you don't want to work with consultation liaison psychiatry because you don't like the medicine part of it, but it's going to be interesting for you to really dive into this rotation because it's going to provide you with a lot of knowledge that you're going to carry throughout your career. So yeah, just basically go through residency open-minded, exploring everything, embracing all the opportunities. And based on your experiences, be able to make your choice. That's what I recommend.
Thank you. Yes, I think that is very much in line with what I tell medical students. Keep an open mind, or even pre-meds. Be open-minded, look at all the other specialties. Don't just be fully set on one thing. I can understand how that can correlate for psychiatry residency. I know something that we like to talk about through this podcast is how your unique perspective has impacted how you work with patients. Do you have any thoughts on that?
My unique perspective on working with patients is bringing it to a mental health perspective. I believe every patient encounter should be therapeutic. Even if the patients are going to a PCP appointment or if they're going to a pre-op appointment, sometimes they go to an appointment just to feel connected to someone, to hear a soothing voice, and they want to have a warm interaction with their provider, right? And there's the white coat syndrome in a positive way. I think so too, because people usually refer to the white coat syndrome as, oh, I go to my doctor's office and I feel anxious, my blood pressure goes high. But I also think that you have the reverse aspect of the white coat syndrome, that patients, some of them, they really respect their providers, and whatever you tell them, they really are gonna adopt to their lives. So I think every patient interaction should be really careful. You got to be really careful with what you say to your patients and how you interact with them, because they need some guidance and some assistance from you. So I think every doctor is like a therapist, even though they're not aware, they can be considered like therapists. This is my perspective on patient interactions and patient encounters.
That's really good advice. I like looking at the white coat perspective in the opposite. There is that respect and gravity, and they will take what we say very significantly. So make sure that when providers use terms that are not respectful, that can have a very much a negative impact on the rest of the patients, on how they're going to see other providers. Maybe they're going to be more scared to interact or share their perspective because they don't want to be looked down upon.
Correct. And especially mental health patients, right? They
Mhm.
can be very sensitive to those interactions. So if you tell them something, it might be something that you say that will make them never see a provider again, another mental health provider. So you got to really be careful with what you say and be really sensitive. Sometimes they're waiting for that appointment for months. Their expectations are really high. So you got to live up to those expectations. You got to keep up with the standards. They might be just one of your 10, 15 patients, but you're going to be their only provider most of the times on that day. So something that I like to tell my friends, and just keep that in mind.
Yeah, that's really helpful and such a good point. From the psychiatric perspective, I know there are some providers that are very set on being pharmaceutical based or very psychotherapy based. Where do you see yourself and your individual passions?
Yeah, great question. I think I want to do a little bit of both. I really like prescribing and managing medications. I think it is important. So I have a good part of my practice dedicated to prescribing and doing medication management, but I also want to incorporate a little bit of even brief therapy while doing medication management with my patients. Not necessarily 1 hour long appointments dedicated only to psychotherapy, but maybe incorporating brief therapy techniques in medication management appointments. I feel like I want to do a little bit of both in the future, but let's see. I'm also very flexible. Let's see how the fellowship is going to go, and maybe I'll change some of my preferences during the fellowship. So let's see.
That is the great part about doing additional learning, right? You get to spend more time doing those. Tell us a little bit how that fellowship works, because you are currently a third year, and not everyone knows about how child and adolescent psychiatry is slightly different versus other fellowships.
So basically, we have five big areas in psychiatry: consultation liaison, geriatric psychiatry, forensic psychiatry, child and adolescent psychiatry, and addiction psychiatry. For child and adolescent psychiatry, the fellowship lasts 2 years, but you can fast track. So you have to go through fourth year before starting your child and adolescent fellowship. So you can fast track and skip the fourth year.
I noticed the voice change. How did that happen?
But I think we're back now.
Saying of fast track regarding fast tracking.
So you can skip fourth year and start the fellowship straight from your third year. With the other fellowships in psychiatry, since they're only 1 year, you're gonna have to go through the whole residency training. So you got to do the whole 4 years before doing the other fellowships because they're 1 year long. That's basically the main difference.
Now, I heard if you're not 100% and then apply for fellowship in your fourth year and then start after. Was there a reason why you decided to skip your fourth year and go straight into fellowship?
Basically, my 4th year in my program, we have a lot of months dedicated to electives. So I think we have 6 months of elective rotations. But this is something I can do as a fellow. During the second year of fellowship, meaning your PGY 5 year, you can still do a lot of elective rotations. So I thought, okay, I don't need necessarily one extra year. I think I can do my entire training in 5 years. So I decided to skip my 4th year. And this is usually the track that most of the residents who are interested in child psychiatry, that's what they do. They usually skip 4th year and they do their electives during the fellowship.
That's good to know. I didn't even think about that, of doing the electives during your fellowship. What about the board exam? When does that kind of go in? Do you do it during residency still, or do you do it as a fellow?
The board exam for general psychiatry, I think you do both board exams as a fellow, but I'm not 100% sure. So this is a problem for the future, 2 years from now.
Just because I'm right now studying for step 3, and in the back of my mind, I'm like, after this, I'll be done. Oh, wait, no, I won't. There's still a board exam eventually.
But at least you're going to be studying what you like, right? For
Exactly.
not going to be studying those like antibiotics or things like that, anything like that. So
No, thankfully, none of that. Is there any? I know we've talked about a lot of different stuff today. One of the things we also like to talk about, and I also like to ask people about why it's important to bring this diverse perspective of having physicians from all over the place that look different and also have all different types of diversity.
great question. I feel like America is a very diverse country. We have patients from different cultures. If you come to a city like Miami where I live, I need to use the language line every other day. We have a big Hispanic population. We have a big Haitian Creole population. I've seen patients who were Mandarin speakers. We have a lot of diversity in big cities, but I think that we also have a lot of diversity in the entire country. Because of that, I think we need a diverse clinical staff. We need diversity in regards to the providers as well. So I think patients are able to connect better. Mental health patients can be very sensitive. They can have a lot of resistance initially when interacting with a new provider. If you can provide them with a psychiatrist or a psychologist that comes from a similar background, the rapport and therapeutic alliance can be really different, and the patients might have better outcomes in terms of treatment. We need a diverse group of providers because we have such a diverse patient population, and yeah, I think it makes a lot of difference.
Yeah, that is such a good point. And bring in the fact of already in medicine as a whole, there's already such a small percent of Latinx and Hispanic, but a huge amount of patients.
Yeah.
Like you said, in Miami and across the country. I know here in Chicago, we also have individuals from all around the world. So it is so important.
And this is something that we do here in our clinics because in third year, we only do outpatient psychiatry, right? I'm going to give my clinic next year when I start my fellowship to an incoming PGY3 who is similar to me. PGY3 that basically speaks the same languages that I speak so they can connect with the patients I have at my clinic right now. We try to make this transition smoother by finding an incoming resident similar to you once you leave.
That is so cool. I love that idea. And I'm sure that helps the patients because it's so hard to have a provider that you've worked so hard to trust and tell your entire lives and struggles and traumas, and then they're gone.
Yeah,
It
they're gone.
can be
I,
hard.
I have an issue with one of my patients because she's Brazilian. She only speaks
Oh,
Portuguese. So she told me, "Hey, doctor, when you leave, I'm leaving in June. That's when I'm moving forward to the fellowship." So she told me, "Hey, doctor, when you leave, I need another Brazilian doctor to take care of me," which is an issue because we don't have any current Brazilian PGY choosing my program. So let's see what we can figure out. But yeah, this is how important it is for patients to have someone that they can connect to in terms of the language they speak and their culture. This is one specific example of diversity is important.
Yes, thank you so much for sharing that. I think that's a good point. If there's no other PGY2, and I'm sure that's more difficult to find someone. Portuguese is not Spanish. It's a completely different language.
That's true.
Thank you so much. Is there any other last advice that you have for other medical students or healthcare professionals that are going through? I know we talked about before about imposter syndrome, but if there's any other last tip advice that you would like to provide.
I would say that if you are in the healthcare field, one thing I strongly recommend is to take care of yourself first. Make sure you're physically and mentally stable and healthy so that you can provide good care to your patients. I really believe that you gotta take care of yourself first, exercising frequently, sleeping well, verbalizing whenever you need help if you're feeling burned out. Sometimes even take medical leave if you think it's necessary, but just take care of yourself first so that you can take better care of your patients.
Beautiful. Those are so important. I completely agree. And it's definitely something that everyone in medicine needs to hear because we can't provide for other people if we're not healthy mentally and physically and able to just function on a day to day. So it's so important. So thank you so much. And I always like to finish off by just giving a summary of all the highlights that you said. You talked about coming all the way from Brazil, a family of doctors, and you were open, but didn't know exactly what you wanted to do until your final year, where you found psychiatry and mental health as something that went across all the specialties. You went and applied and did IMG, came to the United States, you came to Miami, where it has a very diverse community where you've been able to use your background and experience from being yourself from a different country and helping to support other patients who are in the similar position to you. You also talked about the challenges you went through with step studying by being on your own, but able to manage it. And you provide some really good advice for other medical students and other IMGs of how important it is to be able to network and connect with others, even if it's virtually during those happy hours. It's so important that you find co-residents that you can really connect with. We also talked about why you went into child and adolescent psychiatry, your interests, and that unique perspective you want to go at, and really how you want to work with patients to build that therapeutic alliance with the patient, and how you're about to go into child and adolescent psychiatry. So we look forward to seeing your continued in that journey, and you finalize and just saying some amazing final tips to take care of yourself holistically as providers and students. I want to thank you, Dr. Lima, so much for meeting with me and sharing your story on the Life as a Patient Doctor podcast.
Thank you so much, Dr. Moz. Thank you for having me in your podcast. I've been following your work for a while, for months now. So I really appreciate being here with you and being part of your podcast.
Awesome. Thank you again so much. And thank you for everyone who's listening in. If you haven't already, you can follow the Life as a Patient Doctor, my own story, and the story of all the amazing healthcare providers and students. Make sure you follow them on social media or on the podcast. Without further ado, I forgot to say, how can we follow you? You also share mental health tips. How can we best connect with you?
Yeah, absolutely. So all my platforms have the same username, profile name. So it's Dr. Dr. Anton Lima. You can follow me there. I'm regularly posting content on mental health and trying to educate people with reliable content. I'll be glad to connect with you guys.
Yes, and thank you so much for doing that. It is needed to be able to provide content where a lot of individuals, especially child and teens, are at.
Yeah, absolutely. They're consuming a lot of content, so it's good to have reliable pages out there like your podcast and my profile providing valuable content for them. Absolutely.
Amazing. Thank you so much. Make sure you follow along with Dr. Lima. I'll put his information below in case you didn't catch on to that. So look below where you can see all the links to him and to follow me and get more resources. Thank you, everyone. We'll see you next time.